Hi friends, good evening. Today we will see some questions from a respiratory system. First question, an emergency department nurse is assessing a client who has sustained a blunt injury to chest wall. Which of these signs would indicate the presence of pneumothorax in this client? We will see the option A low respiratory rate, option B, diminished birth sound, option C, presence of barrel chest, option D, a sucking sound at the site of injury. This is the question. So here a client who has sustained blunt injury to chest wall. So client is having a blunt injury. Blunt injury is a type of closed chest injury. Question is which of these signs would indicate presence of pneumothorax in this client? So pneumothorax means air in the thoracic cavity due to injury of chest wall, blunt injury of chest wall. There is a chance of accumulation of air in the chest wall. So here if the client has sustained injury, that is blunt injury or closed chest injury, there is a signs and symptoms of shortness of breath and chest pain will occur. So shortness of breath and chest pain will occur in the patient. So here the correct answer will come diminished birth sound. That is the correct option. And this is in case of blunt injury or closed chest injury. Okay, suppose if the patient is having large pneumothorax, if the patient is having very large air accumulation of air in the pneumothorax, that may cause patient tachypnea, cyanosis, diminished birth sound and subcutaneous emphysema and hyperresonance may seen. Okay, this is in case of pneumothorax. So option is diminished birth sound. Option B is the correct answer. Suppose in case of open injury, this is closed injury. In case of open chest injury, there is a chance of a sucking sound at the site of injury can occur in case of open chest injury. Here our question is closed injury or blunt injury. So blunt injury may cause signs and symptoms include diminished birth sound, cyanosis, tachypnea, chest pain and subcutaneous emphysema. Option B is correct. Next question, second question. A nurse is caring for a client hospitalized with acute exacerbation of chronic obstructive pulmonary disease, that is COPD. Which of the following would be the nurse expect to note on assessment of this client? Options are option A, hypocapnia, option B, hyperinflated chest noted on the X-ray, option C, increased oxygen saturation with exercise, option D, a widened diaphragm noted on the X-ray. This is the question. Here the patient with acute exacerbation of chronic obstructive pulmonary disease, that is COPD. So before checking the answer, we have to know what are the main clinical manifestations of COPD. Then only we can answer this question. So what are the main clinical manifestations of COPD is, that is hypoxemia. Hypoxemia means decreased oxygen content in the blood, and also hypercapnia. Patient is having increased partial pressure of carbon dioxide, and dyspnea. Dyspnea means difficulty on breathing, dyspnea on exertion and at rest. Okay, and oxygen saturation will be decreased during the time of exercise, and also use of accessory muscles for respiration. These are all the main clinical manifestation which we can note on a patient with COPD. So here our question is, which of the following would be nurse expect to note on the assessment of this client? Here option B is the correct answer, that is hyperinflated chest on the X-ray. So due to the clinical manifestation. We saw what are the main clinical manifestations of the patient. So all related to oxygen content, and the chest will be hyperinflated during the time of X-ray. We can see on X-ray there is a hyperinflated chest and also flattened diaphragm. So diaphragm will be flat in case of COPD. So these are all the main points which we are noted on the X-ray in case of COPD patient. Hyperinflated chest and also flattened diaphragm. Okay, option B is the correct answer here. Third question, a nurse is caring for a client after bronchoscopy and biopsy. Which of the following signs, if noted in the client, should be reported immediately to the physician? So our options are dry cough, option B hematuria, option C bronchospasm, option D blood-streaked sputum. So here our question is, after bronchoscopy and biopsy, which of the following signs, if noted by a nurse, should be reported immediately to the physician? So here we have to know what are the complications can come after bronchoscopy and biopsy. So bronchoscopy is a diagnostic procedure, that is visualization of bronchi and trachea and bronchi. So it's a diagnostic procedure. Along with bronchoscopy, there is biopsy also done for the patient. So here we can see what are the complications after this procedure, that we can see first. The client should be assessed for signs of complications such as cyanosis, dyspnea, stridor, bronchospasm, hematemesis, hypotension, tachycardia and dysarrhythmia. These are all the main complications can occur after bronchoscopy and biopsy procedure. So if any one of this complication can occur to the patient, that should be noted immediately to the physician. So here the correct answer is bronchospasm. If bronchospasm is occurred, we should immediately report to the physician. And option A dry cough and option D blood streaked sputum. This is a normal thing in this procedure. Dry cough may be expected in the patient after this procedure, and also blood streaked sputum can also expected for several hours after the procedure, and flank blood indicate there is a chance of hemorrhage. Okay, these are all the normal things noted after the procedure. And the complication if developed, that should be immediately reported to the physician. Here the correct answer is bronchospasm. Next question, fourth question. A nurse is suctioning fluid from a client via tracheostomy tube. When suctioning, nurse must limit the suctioning time to a maximum of, options are option A 1 minute, option B 5 seconds, option C 10 seconds, option C 30 seconds. Here we should know the time limit for tracheostomy tube suctioning. So nurses should limit the suctioning time up to 10 seconds. Okay, before suctioning, nurses should also pre-oxygenate the client before suctioning. Otherwise, there is a chance of hypoxemia can develop to the patient. Hypoxemia means decreased oxygen content in the blood. Okay, and also if a nurse is doing prolonged suctioning to the patient, that can also lead to hypoxemia to the patient. Once there is a hypoxemia developed in the patient, there is an activation or stimulation of pacemaker cells in the heart. If the pacemaker cells is stimulated, there is a vagal response may occurs for the patient. This may cause bradycardia. So the suction time should be limited up to 10 seconds. Prolonged suctioning may lead to hypoxemia, which may cause activation of pacemaker cells, and there is a occurrence of bradycardia. Bradycardia means decreased heart rate. So our answer here, the correct answer is option C 10 seconds. Next question, fifth question. A nurse is suctioning fluid from a client through an endotracheal tube. During the suctioning procedure, the nurse note on the monitor that the client heart rate is decreasing. Which of the following is the appropriate nursing intervention? Options are: first option, continue to suction; second option, notify the physician immediately; third option, stop the procedure and reoxygenate the client; option 4, ensure that the suction is limited to 15 seconds. Here, a nurse is suctioning a patient on endotracheal tube, and also during the time of suctioning, nurse noticed on the monitor that the client heart rate is decreasing. So, what action she should do immediately? That we should know. So before doing the answer, we have to know what all the side effect can occur during the time of endotracheal tube suctioning. So what are the side effect can occur is: first one, hypoxemia will develop for the patient, and cardiac irregularities such as decreased heart rate may come for the patient, and also mucosal drama will occur, hypotension can expect, and also paroxysmal coughing can occur in a patient with endotracheal tube suctioning. So here the patient have decreased heart rate that she noted on the monitor. So what she should do is immediately she should stop the procedure and give oxygen to the client. Here option C is correct. Stop the procedure and reoxygenate the client. Okay.